there. Good morning. Thank you for joining us today. My name is Stephanie Urbanski. I'm the clinical director for the 10th floor. I have been at Cooper for a little over 18 years. I've walked through the door and never looked back. I have loved every second, every day that I work here, and look forward to telling you today what we look for in new candidates, and we welcome all new nurses to our units. I brought Julie Hunter and Rebecca Yarnall. They are both nurses on our unit, and they're going to tell you what great things we have to offer.
All right, so my name is Julie Hunter. I started at Cooper a little over 2 years ago, actually in the nurse externship program. After the summer, I was done with the externship program, so I actually went to staff and started as a tech. So I was a nurse associate up until I passed my boards, and then I still stayed on Kelemen 10 as a registered nurse. So I've been up there a little over a year as a nurse now, so definitely learning a lot.
My name's Rebecca. I also started in the nurse extern program about 7 years ago, forever ago. And then I went on to be a nurse associate, so I was a tech. And then I got hired by Steph over here, started in the Med-Surg unit. And then after 6 months on the floor, I transitioned to our INCU, which is the ICU step-down unit in critical care, and I've been there ever since.
So what does it take to be a Med-Surg nurse here at Cooper?
I think you definitely have to be caring, compassionate. For our unit, you have to be a hard worker.
Yeah, you definitely need that. The teamwork part of it is actually very, very necessary to get through any day on our floor. Our floor is sometimes hard to handle, but it's great because it's a really great experience every day, and we see so much that, I mean, the experience is very worthwhile, especially for like a new nurse since I started. I feel like I've learned more than abundance in that time.
I would say one of the best things I think about being a Med-Surg nurse is your assessment skills. You have to be upfront, be able to walk in a room, look at your patient, and know what's going on with your patient. And you will learn that over time, which is great to start on a Med-Surg unit because you gain that experience that you're going to be able to walk in your room, assess your patient, and know exactly what that patient needs. Other units, they do have higher technology that allows them to read exactly what's going on with the patient physiologically. But again, as a Med-Surg nurse, the best quality that you have is being able to look at your patient and know what to do to take care of that patient to make them better.
Always trust your gut.
Oh yeah, definitely.
Which I think Med-Surg definitely teaches you how to do that as a new nurse.
Yeah, absolutely. I've had so many situations that it really kind of just calls on those assessment skills that you've been growing ever since you started. So it's really nice to see a change in time.
And what kind of patients do we normally typically see on the Med-Surg unit? What would you say?
We really see anything under the realm of medical, surgical, but then we also get trauma downgrades as well as critical care downgrades. We'll get downgrades from the INCU, so we do really see a vast majority of patients. We see some complex behavior cases as well, so I mean every case is different, but there can be a lot involved with every patient's care.
So you name it, on this unit, we are able to take care of those patients again, which is something unique about our unit, and it's unique to be a nurse on our unit because we take care of GI patients, we take care of ortho patients, we take care of ophthalmology patients, diabetics, wounds, you name it, we take care of it. And that what makes you also grow professionally as a nurse is that you are able to learn and grow and be able to take care of all these types of patients.
So you asked, are nurses who go through the nurse extern program stronger candidates? I wouldn't say necessarily yes. We're open to all nurses. Everyone should definitely apply, especially as a new nurse. I know there's always talk in nursing school you don't really want to start on a Med-Surg unit, but I think it's the best decision I ever made.
It's definitely the best decision.
It has taught me how to be such a good nurse. You really learn time management, prioritization. It just so happens that we both happen to be externs, but I think we're the only nurse externs on our floor that started that way.
So don't feel this way, please.
All are welcome.
Yeah, but I do have to say that while I was a nurse extern, that actually gave me the foot into the door to start at Cooper, because beforehand I wasn't working in a hospital setting, so it really kind of gave me that first stepping stone that I needed. And then from there, I just really, talked with HR. I talked with Steph. I was like, listen, I'd love to work here. And so that's really, it's just getting your name out there and making sure that, they know that you want to work here. And that's the biggest thing.
What would you say is the best thing from the nurse extern program?
I think you just really get to see Cooper as a whole and their values and the type of nurse that they expect you to be.
Yeah.
And do you work alongside a nurse during?
You do. So you get paired to a specific unit and then a specific nurse for, it was 12 weeks when I did it.
It was an 8-week program when I did it in 2016. So
yeah, it was 2012. So.
Yeah. It was honestly a great program though, because it just gave you that experience and also kind of helped bridge that gap between what nursing school, book nursing versus what the actual hospital setting was like. I feel like a lot of nurses, when they come in, they're still thinking about boards and NCLEX, and that's still on their mind. So I think it makes a really big difference because it really opened my eyes. Like, okay, now I understand why, we're giving Lasix for this heart failure patient and whatnot. Like, it just makes everything kind of connect more. So, yeah.
So part of the nurse extern program is, you submit an application, you're still in nursing school. Just because you don't think the extern program is a fit for you, we also have other opportunities for you. We do love to take nursing students as nurse associates because we like to get them in the door. We like to make sure that they're a fit for us. We want to make sure that, they get to see the exact patients that we get to take care of. So if you are interested, we have multiple job openings online, and they're called nurse associate positions. And we will work with you with your schedule. We support all types of education, so don't let that deter you from coming and joining our team. We will work with you to make your schedule work.
Oh, yeah.
Yes, they do.
Yeah. What's another question?
We're on 3.
All right, so what makes Med-Surg on our unit different from other Med-Surg units?
I personally think our teamwork that we have on our unit, it is 3 units combined into one. So there's just the general Med-Surg, then there's medical telemetry, and then there is the 12-bed ICU step-down unit. But no matter which floor or side the nurses work on, we all just help each other out. And if someone's struggling, people jump in immediately. Same if there's a code or something, there will be 40 people in that room.
There will be.
In 0.2 seconds. So I just think we all have a really good relationship that it really does help us provide better nursing care to the patients as well.
Absolutely.
We also have a great working relationship with our physicians on the unit.
Yeah.
We are all, considered one team, one purpose. We're here to serve, heal, and educate. We all work collectively to ensure that the patient, gets the highest quality patient care while they are here.
Yeah. I definitely agree.
And I also want to add on to what Rebecca was saying, that our unit is definitely unique. We do have 3 units in one. The one side is a Med-Surg unit. The other side is a step-down intermediate care unit and a telemetry unit. So it is a great opportunity for new nurses to come in, get some time under their belt to start a Med-Surg, and then we also offer to cross-train into the intermediate care unit. So we will give you all those qualifications that you need to grow professionally. So if quick care is somewhere where you see yourself down the line, the 10th floor is absolutely a great spot for you to start at.
Yeah. So what are some Med-Surg RN opportunities available at Cooper?
So we have many Med-Surg opportunities at Cooper. The link is right in the description. Please take a couple minutes, log on. We have, again, multiple units that are looking for Med-Surg nurses.
Mm-hmm. So who's the best candidate for this role?
So someone that we're looking in, is someone that's caring, compassionate, and most of all, we want dedication. We want to make sure that our employees are dedicated to the care that they provide to our patients. And we also want to make sure that they are a team player. So we're here to take care of our patients, but we're also here to take care of each other. Yeah. If we don't have that support from each other, we can't deliver the high quality patient care that the patients deserve. So again, we want somebody caring, compassionate, dedicated, and wants the best for all of our patients.
And basically, just to add on, what we look for in new grads is what she said, and just someone that's willing and eager to learn. Someone that wants to learn new things, isn't hesitant to learn new opportunities, and kind of jump in and be very hands-on.
Exactly. So definitely you need to take the initiative. You make what your experience is.
Yep.
So if you come in here and you seek out all these experience, you will get the best experience as a nurse to start your career off. And best of all is we have those types of patients that you can gain the knowledge from.
Yep, I agree.
So when are we looking to fill our positions today?
Immediately. Right now.
We'd love to have you
for us.
We would love to have you on our team. You can see, we're a pretty good, funny bunch.
We are.
We can be serious when we need to be.
Sometimes.
So if you have any questions, type them in. Let us know what your questions, your concerns are. We're here to answer them. We want to make sure that, we take all the time today to answer all your questions.
Yep. And then, of course, after the hiring process and everything, it's a whole learning curve entirely. So, even from when you start moving into, the first year, everything, you'll just constantly be learning. So even with new grads, as long as you're just eager to learn and ready to jump in and kind of get your hands dirty, as they say, it's a really great experience. It really is. I am so thankful for all the opportunities that I've had on my floor. And I'm really thankful that I started as a new grad because I feel absolutely ready to do whatever comes next in this crazy career. So, yeah.
So during your orientation process, you will be supported by the leadership team. Within that leadership team, there is an educator, there's myself, and then we also have an associate clinical director. We will give you all the tools that you need to be successful. We will work with you. We will set clear expectations so you will know what you need to do to be successful on our unit. We will meet pretty frequently. And what do you think? How was your orientation?
My orientation was great. I had a fantastic preceptor who really taught me a lot. You kind of build a good relationship with your preceptor as well, and they're there for you for whatever you need.
Mm-hmm.
And I felt like I could go to them for anything.
Yeah, I think it was also really great because since we both started, not even just as externs, but as techs, we already knew the unit. So going to our preceptors, it was very easy to communicate any needs. But then also I actually just got done precepting my first nurse, which was honestly the best experience. I had a lot of fun. So it's nice to know that after this time, I'm finally more senior to be able to give that knowledge out, and knowing that my trainee can still come to me with any questions or any new grad nurses. It's nice to finally feel like you actually know what you're doing. No, I'm kidding. But it's a good experience, and it's fun to see how much has changed in that time as well. So it was a very good experience.
So Julie chose to stay on as from a nurse extern to a nurse associate. So she worked throughout her whole nursing school. Again, she could tell you that we worked with her schedule. We did whatever we could to accommodate her because, again, her success is our success. She did really well, and as you can see, she did so well that we hired her, and we're glad to have her. And Rebecca.
Yeah, don't forget about me. I've only been here for 7 years. What should candidates expect if they are asked to interview?
So you always want to come prepared. Come prepared with your questions. Do a little research about how we provide care here at Cooper. Sell yourself. You want to come in the interview and you want us to hire you. Mm-hmm. Sell yourself. Tell us why we should hire you and why you're a fit for our organization.
Know the mission statement.
Mm-hmm. And what makes you different? What experiences have you had in clinical or nursing school or in life that picks you out of the bunch, pretty much, and shows that you are going to be that dedicated nurse that's going to provide the best quality care for your patients? Yeah. What should viewers do if they want to learn more or apply?
So I believe there is a link in our description. You could just click on that. You'll be able to get all of our job opportunities.
Cool. And I guess the last question, why do you love working at Cooper?
I personally love the people that I work with. It's a great environment. I actually wake up and want to go to work, and all the complex patients, I feel like you never know what you're going to get. You're always learning. Like I said, I've been here for 7 years and I still learn something new every shift that I'm on. So I never get bored.
And I learn from her every shift.
We actually learn from each other. So I've been here for almost 19 years. I have started on this unit and I have never left. So that's one thing that I can say. If you love it, you will definitely stay and enjoy the experience. Again, you learn something new every day. Sometimes you can't believe some things that you see, but it's great to know that, things exist and we do make people better, and we get them out of here and get them back. And sometimes, they go to rehab and they come back and, thank us for all the great care that they've given us. Especially Rebecca can talk to, in our step-down unit, we receive patients on sedation drips, ventilators, which are breathing machines. And one of our main goals in the intermediate care unit is to get people off these breathing devices. So we do weaning from the vents, which is great, so that we can get them to rehab and they can start their life again. Rebecca, I'm sure, you can definitely say, the patients that we get are sick in the INCU, but it is the best reward when you can make them better and you take them off that breathing machine and they start talking to you.
Yeah, and they look at you like you're a hero.
Yeah,
so
because they've been seeing you that whole time and you're like, hey.
It's awesome. Yeah, it's a very rewarding feeling, definitely. You definitely build a relationship with the family too, because they're in the INCU for long periods of time because they're really sick. So it's nice you kind of have their support as well.
Yeah. I would say even on the Med-Surg unit too, you can have those experiences. I mean, I don't have patients on like vents and everything, but even with patients that have went through like strokes or they've just been going through a really hard time with like their family, and then just learning, all their family dynamics, and you can also have like the same support and they'll still, be very thankful for their care. So it's very heartwarming as a nurse as well to already have these experiences and know that, there's so many more lives that we can touch. So yeah. Cool. Any other questions or anything? All right, so.
Well, thank you for joining us. We hope that we were able to answer all your questions. Again, we're more than happy to have you on our team. Please just click on the link and start the application process.
Apply today.
Yeah, come work with us.
Yeah, come on, we're fun. Thanks, guys.